Our next speaker is Hilda Palmer, who is from Greater Manchester Hazard Centre, and they are actually officially supporting this meeting, and I'm very glad to welcome Hilda. So over to you, Hilda.
Thank you very much. Brilliant to be amongst so many great people, and thank you very much for the invitation. The Hazards Campaign and Greater Manchester Hazard Centre are very pleased to support the People Before Profit emergency plan. Workers' rights to a safe and healthy workplace should be a fundamental human right, but this right is effectively denied to many workers in the UK by 10 years of government hostility to regulation and enforcement. Before COVID, it was very clear that the government had broken the health and safety system in the UK. The pandemic has further exposed how unprotected workers really are. Negligent employers have been given even more unrestricted power to determine what constitutes safe workplaces, without checks by the HSE or local authorities, weak, inaccurate and unenforceable government guidelines that expose workers to huge risks of infection, don't enforce their rights to be consulted, to challenge, to be protected, and denies them adequate PPE. Well over 6,000 people of working age have died of COVID. Many tens, maybe hundreds of thousands of younger workers are suffering chronic ill health of long COVID with long-term implications. And it's all due to government corrupt, catastrophic class war approach to the pandemic, which enriches private failed companies like Circa, as we've heard, while refusing to support millions of people deprived of their jobs and income, as we in Greater Manchester have brutally heard today. Workers' health is public health, and in a pandemic, you don't protect public health if you don't protect workers' health. And the government did fail to protect workers by locking down too late and incompletely, allowing too much non-essential work, then relaxing too early, forcing workers back to unsafe workplaces, including schools and universities, against all the science and the advice of trade unions, without getting the infection rate down or effective test, trace and isolation running. A tsunami of workplace outbreaks has followed. Infected workers take COVID home to their families and communities, driving the infection rate up. The Hazards Campaign has been working at many levels, making clear that it's the workplace that's the front line and to stop blaming individuals. We've been trying to pressure the government to adopt a zero COVID policy and adopt our safe return to work plans. We've been trying to get the HSE to properly enforce health and safety law, which hasn't changed during the pandemic, to produce and enforce good guidance, especially to prevent aerosol transmission, to investigate outbreaks and record deaths and illnesses and support workers. And we've been supporting safety reps, the heroes of the union movement, who's organising and save lives and health all across the country, just with everything that they do. And we've been doing that, supporting the rights of workers to refuse dangerous work, the need for roving union reps to get into non-union workplaces. The government and the HSE won't save us. Only workers can get us through this by working together, taking collective action, solidarity, fighting for our lives and our physical and mental health. Join a union, speak out now, not just to get us through COVID, but to put workers' lives and health at the centre of plans for decent jobs and lives, and rebuilding a cleaner, greener and better world for all. Solidarity.
Thank you very much, Hilda. And again, people are saying how much they agree with you, and well said. So thank you very much, Hilda, and thank you for the Hazards Campaign for supporting the emergency programme.